Oh man. Okay, so so yeah, we're probably live now. So that's fun.
Yeah. Okay. Let me refresh here and see what's going on.
Yeah. Oh yeah, look, we're even live right now.
Here we are.
Hey guys, I didn't realize you guys were officially doing this thing.
Oh, hey,
we are
Ash is here.
officially doing this thing. I should stop sharing now.
Yes,
because
you
it was
should.
actually showing. It was showing the screen.
So, good morning, everybody. Our guest this morning is the indomitable, the amazing Ash Gallagher is joining us live from somewhere in Asia this morning.
I'm in Malaysia, guys.
In Malaysia. I just keep forgetting which Asian country you are in.
That's okay.
Apologies for that. And she's got some things she wants to talk about, and there's a whole lot going on this morning.
I mean, not really.
I just kind of forgot. I was like, we kind of grazed it, and I was like, oh, and then all of a sudden I get this link in my inbox. I'm like, oh, wait, okay.
Yeah. Greg and I have been sort of updating each other for the last 20 minutes. I'm like, wait, we decided we were going to do this today because we are going to get Ash on, and we had not sent you the link yet or talked to you or fucking anything. It's one of those mornings. I ended up staying late watching things. Just to give people a quick update. Overnight, the Dow futures got suspended again, and they got suspended like 3 minutes after trading open this morning for 15 minutes because of the 7% down limiter. That will not be limited again today unless it hits 13%. All of this is just, it's just the beginning.
Yeah, there is a lot going on. I mean, look, the world has gone a little bit crazier than it probably should, but at the same time, there's definitely room for concern. And so, here we are.
Yep.
But, oh, sorry, I didn't start my video. Gosh, that's my fault. Okay.
Hey, there she is.
Tea in hand.
There you go.
I'm here.
Yay!
A little behind today. I've actually been at home. I've been kind of doing 2 days in, 2 days out, so as to kind of take my own precautions. And so today was my sort of first couple of days in until probably the weekend. It's sort of cleared out here a little bit. The government is obviously encouraging people to, stay at home and don't go anywhere unless you got to go to work kind of thing if you need to. But it hasn't completely shut down. They've had, I think, confirmed 100 to 150 cases, but 25 people have been sent home. No deaths at all that have been recorded.
That's good.
And the government's been a little bit in disarray here. So the health ministry itself has had to kind of step it up on its own. But they've done a pretty good job. I read today in the local media that they were putting actual doctors at all the main entry points, to be more attentive to the people coming in and out. And then they put I think a travel ban, on places like Italy, China, kind of the major places. Most people don't realize there's a lot of Chinese here. Malaysia has a significant Chinese influence, and their relationship with China is typically quite strong. Every other person you'll meet here has maybe at least one Chinese parent,
right.
or something like that. So, they're definitely taking precautions, but nobody's really worried. As far as the masks and stuff, I see about 40-60. So I see people with masks on, but not a lot. People wash their hands. I got into a conversation with, there's one of my favorite little sandwich shops that I go to, and we talk every once in a while, and she said, here's the thing. She goes, I'm actually surprised at what I see in the West. She goes, because in Asia, we have a value for people's healthcare. It's free. I don't have to worry about it. And she goes, I feel like Asians are cleaner. I laughed at her. I said, probably.
I think maybe
on some level.
Some of what I was reading yesterday talked about the Asian response to pandemic things like this is better because they've been through it more, right? Because of SARS and all the other things that you've learned some lessons that we haven't learned over here in our isolated northern hemisphere, western.
And now some people say, well, these governments are authoritarian, but some of their authoritarian system ends up sort of working a little bit. Like, for example, the makeshift hospital that China built ends up being sort of one specific area that people go. that they're now going to send these cases to get it done. I'm looking at the United States and going, why doesn't each state have a designated spot like that? Like designate 2 hospitals or something. I don't know.
Right.
I don't know what that would look like exactly, but if it feels like to me that in the United States there needs to be more organization around just creating a space where if someone's sick, they're going to get it free. The insurance companies are going to stand in the way, and maybe there's only a few hospitals in the state that take charge of it, so that maybe there's not as much being overwhelmed with everybody going to their local hospital down the street and maybe not having enough kits or not having enough treatments or not having enough supplies, that kind of thing. So I feel like there just needs to be better solutions, because what you see in Asia and Malaysia and Singapore and China is you see mass organization of just people mobilizing to get it done. And so their numbers begin to start to go down, and then Italy's and the US and different people in the West are starting to go up. I was actually just reading a report, though, that was saying that at least about half the cases that have been recorded, according to Johns Hopkins University, are technically considered cured. And so we just need to kind of keep those things in mind and be concerned. We've talked about this before, but be concerned, but don't be fearful, and use this time to learn how to organize, learn how to connect with the community on video like this. I mean,
Yeah,
right.
I think this is one of the things, like there is a way to connect with your community and mobilize without necessarily having to be in someone's face. We do have the technology in 2020.
Yeah, I'm not as optimistic as you are about where we are in the United States right now. Like we, in Pasco County, which is where Corey lived until recently, where I live, just north of Tampa, we had a second and third case confirmed this morning, and it appears that there's already community spread. In other words, we're out of the phase where we could contain this and into the phase where we're going to have to mitigate it. And that being said, our bed capacity for intensive care cases, we can't catch up with that curve. Like even if we started right now today in an almost militarized response, we're not catching up with this that quickly. So I actually think that our rates of infection and fatality are going to be closer to Italy than they are to what's happened in other places.
I agree.
When I read the list of things that South Korea did, for instance, and China did to mitigate, to flatten that curve, like there's just no way Americans are going to do those things. I just don't see us responding as universally as Asian countries have. Like I wanted to be careful this morning not to come on and be, the sky is falling, everybody panic, because all the toilet paper you bought and the hand sanitizer isn't helping. That's not,
or the masks and maybe even the gloves. Like that,
the masks are supposed to keep sick people in. It's not going to prevent you from getting the virus. Every doctor and medical professional has said this.
The minute people started talking about this, there was a run on masks for people that aren't yet sick. So those masks are now unavailable, not only to people who are sick, but to people who are working with people who are sick. So, we, like not being out in front of this, it's tough because we clearly have a president and an administration who are absolutely unprepared for this. I'm not sure that having Obama at the helm in this moment would have done any better, because systemically the things that would have helped us to have in place a year ago, 2 years ago, really aren't there.
But I think that the main difference would be that they did have a task force set up for this. They would have understood 3 months ago how bad this was going to be, because they would have had people on the ground.
Would have been possible. And
I mean, it would have.
They closed 37 of 47 of those prophylactic foreign offices. We had offices open in 47 countries.
Yeah,
to help us identify a pandemic sooner and keep it over there.
Yeah,
which is how we treated Ebola. So I'm trying to be fair, but I'm saying that systemically, with so many people uninsured or only able to seek emergency healthcare services when they're really, really sick, we don't have a way to treat people that don't have the money to be treated.
Yeah.
Right. And to have the president go on last night and make an absolutely dishonest statement about testing availability and what insurance companies are going to do in this moment. What he said in the speech last night was insurance companies have waived the copayment for treatment for coronavirus. That is not accurate. And the insurance industry spokespeople today were like, no, we're going to waive deductibles for testing. That's not the same as treatment. So, what's going to
Well,
happen?
we also have a president that everything is about the bottom line and how he benefits or doesn't benefit, and so he just comes out and he lies about things. And I think that would be the difference between a previous administration, which they wouldn't have come out and dealt with it like that. I mean, there was an article I read today about how Merkel, there was some complaint that she didn't come out soon enough, but she did take time to gather her facts, and then she showed up and she was honest and she was forthright. And she said, okay, now here's what we need to do. We need to figure this out. So she showed leadership. I read, I think it was a Washington Post article, Corey, I think it's actually on my Twitter, and Rachel Maddow actually put it out as well, but where he appeared scared, he appeared disinterested, he appeared frustrated, he appeared basically emotional. He didn't want to be there sitting giving in a speech about, trying to conquer coronavirus or anything else. He doesn't like the fact that he's going to lose out on this. This makes him look awful.
I think he also was heavily medicated last night. He was breathless. I mean,
absolutely.
I mean,
the sniffles were not reassuring.
Like, he looked sick.
Yeah.
And
I think that's the problem. Yeah.
The prime minister of Brazil, who was just at Mar-a-Lago, is
it wasn't the prime minister. It was
whatever.
High government official from Brazil.
Yeah. Is waiting on test results and might very likely be positive, right? It was spent the weekend with them, hugging at Mar-a-Lago.
Right.
So, and there's people in I like Greg, was totally right to get me on the horn before the show. Because I spent the morning listening to a virologist on the Joe Rogan podcast. Everyone knows I've been pretty concerned with this because I saw the writing on the wall with an exponential curve a couple weeks ago. And it, per this virologist, it's significantly worse than I thought, and primarily because the United States is not prepared and will not be prepared federally, right? The VA is preparing, obviously Babs works there, so I get a little bit of the inside track about what they're doing, but they're just now getting caught up as well, right? Like they're clearly going off a Pentagon-led plan, but at least they have one. I don't think private hospitals are doing that at all. And hopefully they will start. I mean, certainly when they start to get cases, they'll start to figure it out.
And Dave Myers actually brings something up. It's airborne. I read in Associated Press today that there's some initial tests that have been done about the fact that it's going to go through your nose and any opening that it can into your body, and that it's not just about touching other people. It's
not at all.
So you have to just be aware. I mean, which, it's funny because even in the house that I'm staying in, I stay in an Airbnb, and there's a few of us that live here, and we've all just kind of collectively agreed that, the common spaces, which is really just kind of the kitchen, we just need to be very vigilant about and be constantly aware of and so forth. Because, we go in, people who go in and out. And that's why for the most part, we've all kind of elected to kind of stay home and stay in our spaces. That's
the biggest thing that we can do. Dave is right. Avoiding large crowds is probably the only thing you can really do at this point. Good news, though, you'll survive. That's the thing. Like anyone younger, one of the starker things that jumped out is that the hospital beds in Italy are full of 40-year-olds, right? Like the whole idea that it's just older people dying. Well, yeah, it's just older people dying. But if you're in your 40s, you still might need to be intubated. And the number this guy dropped is that 70 or 80 million Americans are going to get this, and 30 million might need hospitalizations. 30 million. There's 200,000 open beds, right? So there's going to have to be like a World War II level mobilization over a short term, right? If this was going to happen over 10 years, it wouldn't matter. You space it out. The ways to solve this are like, it's not like we don't know what to do, but stuff is going to run out. Like that. That's the issue. Sure. The reason why Italy went from like, this isn't a big deal, what are you doing, it's okay, to like, well, we're going to close the country down now. I'm sorry. That was like the worst. Awful. That was the worst impersonation of Italian.
The Mario Brothers.
That's all I got. That's literally all I got.
And and I know people in Italy, and so like my heart goes out to the country because I know that it's a really complicated space. Norway actually announced today that they're going to have the largest mobilization that they've basically ever had in peacetime.
Yeah.
And shut down schools. Friends of mine in Colorado said that the universities there are preparing to shut down for the rest of the semester.
They already have here in Florida.
Schools in Florida doing the same thing.
So everybody's kind of going into spring break anyway. So I do want to address something really briefly though. We're starting to hear the word social distancing which I want to encourage people though, that because I know how sometimes these things can go to an extreme and people are going to feel isolated. And so if you are staying home and if you are sick, and anybody watching this, please know that technology exists and that we do live in a time where you don't have to feel alone. I've known many cancer patients over the years, and anybody who's ever been sick knows that when you go through something really difficult and you feel really alone, and you already are having to quote socially distance yourself and self isolate, it can feel really horrible. So from an emotional standpoint, please use the technology in your community, because I feel like that's what happens is people either go crazy one direction and just ignore it, like you see all these people gathering their cheap flights to go to New York, or they do this whole social distancing and then everybody just sort of feels like, oh, I don't know what else to do. Let's come together as a community. We can still come together as people and as communities. Let's just use what's available to us while we sort of take time to let our bodies stay as healthy as possible in these circumstances. Because yeah, go ahead.
No, it like I think that's really, really, really good advice, and to the point where maybe during this crisis, Greg, we go back to going daily, just for a bit, or I will, or whatever, right? Like if people are really, and I want to say if, but it's when it's going to get recommended that everyone just stay home. Just having that, hey, like, it's not social distancing,
right?
It's physical distancing. And here we all are, just hanging out in our, hanging out with everyone,
I want to go back up to a specific local comment. Sherry Burney asked, wait, 2 more cases in Pasco? Yeah, this morning. Now, this is from the school. This is not from the health authorities yet, but Bishop Larkin School on Little Road has closed. They had a parent and a student test positive. So they're going to do a deep cleaning and distance learning for now. So I haven't seen, there's no health system report from that yet. That's from the school itself. So yeah, 2 cases. That's West Pasco. That's on Little Road, not far. Both of my kids attended Bishop Larkin School, Catholic school, all the way through from kindergarten to high school. And my dad's name is actually on the science room, is the Wayne Smithwick science classroom at that school. That's so that's pretty close to home. But yeah, that means like it's likely now that we're seeing community spread, not just travel related spread. The other case we had in East Pasco County, yes, the person that he had contact with had traveled elsewhere, but after he got sick, before he was diagnosed, the local guy went to the gym. So there's the likelihood that he infected other people in his daily travels. So it's not great. And while it's true, like I want us to be very careful not to cause panic. It is true that if you're younger and you get this, it is going to be like a bad flu, and that's survivable. But if you are breathing and coughing on people who are in a high risk group, Greg raises his hand and his mom's hand and his roommate's hand. If you infect those people, then it's a much more serious problem. And that's not me worrying for myself. I'm sort of fatalistic this morning. I've been sick for so long that it's kind of, it's just one more thing that I might have to contend with. But, it really concerned me for my mom. She was scheduled to have elective eye surgery on Friday, and I had to have a conversation with her on Monday about, this may not be the best time to do this. And she canceled the surgery. But we also, we work in a rehab / counseling environment where we're in small group rooms with clients who have much higher risk factors, right? Getting people that are just coming out of jail, people that are living in halfway houses and treatment facilities that come to our office and sit in with us. And, we had to have a serious conversation yesterday about we can't suspend operations because these folks have court dates. They have case plans to be reunified with their children. If they fall behind on a case plan and they go to court and they've missed a bunch of days, they may lose their kids. So there's really no way for us to halt operations without negatively impacting a whole bunch of other folks. And so I started thinking about all the other people I know in this community that do that kind of work, all the people I know that work at homeless shelters, all the people that I know that do relief for homeless people, food banks. We participate in a food co-op at our house, and we're scheduled to go over this afternoon and pick up a bunch of groceries from somebody's front porch. And she already messaged us about, we're going to have a protocol. We're going to have hand sanitizer out, no hugs, like just come get your stuff. We'll wave at you, high five, kapla, live long and prosper. And then, so we're already having to find ways what we need to do is flatten out that infection curve. And the way to do that is to start making a plan for simple things you can do to make sure that you're not making the problem worse. When this came up, Michelle Freeman and I were going to go see Dave Eichenberger, who's in the thread right now, and Julie Black perform at Zenfinity, a local coffee bar, on Saturday night. She messaged me yesterday, geez, maybe we shouldn't go. And I was like, what? I'm going to have to change my behavior? Because I think that's how a lot of people are seeing this. Oh, this is a bad thing. I better get toilet paper, but I still got to go to my kid's basketball game this Friday. No, maybe it's time to rethink, those large groups and closed environment kind of gatherings.
Well, let me try to encourage this a little bit, because this has
Sure.
become such a theme with me in a big way. And that is, as human beings, we're so deeply disconnected from the earth and from our body. And so, while this is a really good time to figure out how to remobilize efforts, especially when there's certain people who can't necessarily take time off of work, or like you're working with people who are coming out of prison and working with people who are more susceptible and things like that. I think one of the things that would be worth implementing in all of our conversations with our friends, with people we work with, whatever, is paying attention to even simple things in like how we eat, okay, and how we sort of just take care of our body on a regular day. Things like stress can actually make you more susceptible to sickness. And even the way that we eat, and this is a time to consider like taking more vitamin C, or having some vitamins on hand from your local pharmacy or something. This is a time to kind of think about what kinds of food that you're getting up in the morning and eating, whether it's like fruits and veggies. Are you getting enough things that can help build your immune system? And the reason I talk about it is the more you build your immune system, the easier it will be that if, God forbid, if you catch it, that your body will be able to fight it off a little bit. And so I think that it's really important that we sort of also just sort of reconnect with our body just a little, enough to say, okay, what am I consuming in my day? What kinds of things am I picking up from the food co-op or the grocery store? How can I do this differently? What is one meal I can change in a day? What is one snack that I can eliminate in a day? Can I eliminate, getting a bag of chips for a bag of nuts or something? I don't know, whatever it is. The idea is to build your immune system and understand what you need for your body. This is the time I think that is worthy of educating ourselves a little bit on that, so that we can everything from air pollution to our sort of instant gratification of like fast food and stuff like that is completely out of control in the country. And we know this, like it's in our head. But the problem is that when we consume all of that thing, when we don't think about how much time we're spending in nature versus how much time we're spending on the cement, we become so disconnected, and then our immune systems, our physical bodies are so connected that our immune systems go down significantly, and we become more susceptible to sicknesses, to diseases, to bacteria, to viruses, to all those things. And so I think in every conversation that we begin to have, and maybe it's something that you can take even into your sort of group therapies, and just, kind of gently reminding people like, hey, if there's something you can substitute, having a glass of orange juice or whatever instead of the Dr. Pepper. Smokers might not necessarily stop smoking, but maybe it's just changing up how often, or things like that. Just it's the small things. To me, it's the little things, and those little things will actually make your body better. It'll make it more resilient, and so that when this comes up, you will feel like you can fight it off a little bit easier. You won't feel so run down. Maybe an extra exercise, an extra run, an extra yoga class, whatever that is for you. And then I know Corey has kind of the sort of meditation group and everything like that. Even little things like that, taking 10 minutes in a day, 20 minutes in a day, just to spend time with your breath, spending time, even just simple breathing exercises, even if you don't believe in anything that's really spiritual, can actually improve your health significantly. So, I know that there's a lot going on and everyone's trying to figure out what to do in these situations, but if we're going to talk about the idea of preventing ourselves from getting this disease, there's little things that each and every one of us can do every single day to just improve our health enough that when it comes up, we can fight it off a little bit better. And maybe we're not one of the ones that goes to the hospital.
Right. Noted health expert Dave Myers in the thread says, I'm wrapping myself in quilted northern and arming myself with a Lysol fueled flamethrower before I leave the house today. Going full Mad Max. It's the only way to be.
Okay, for the record, Ash's advice is better. But
Is it though?
Lysol fueled flamethrowers might be a good way to keep people at a
Sure.
respectful bubble distance
Yes.
or something.
Yeah, it's called antisocial distancing.
Right. Nice one.
Oh,
Dave
Oh.
Myers, I'd like you to see you draw a picture and put that up because I think that's the
I-
meme that we need right
yeah, I want that on a shirt. Stat.
Studies
Yeah, I think-
have shown that elderberry syrup has a blocking capacity to flu.
No,
Let's not.
no,
Let's
Just-
not.
no.
Yeah. Yeah. I'll stop.
That's
right
like
there.
that's like Rogan on the podcast. Like, hey, these guys told me that like being in a sauna is great for 20 minutes because like it kills the virus. Is that true? And the
No.
guy's like, no.
For it
like,
to
not
be
even
hot
a
enough
little
to
bit?
kill the virus, you would have permanent lung damage.
You would
just
have
from the
permanent lung
steam.
damage.
Yeah.
But no, but like it's totally no, Rogan, no. Like almost
Jimmy-
anything you hear about this is, oh man, this will cure it. It will not,
Right.
unless it's coming from the CDC. It's not gonna work.
I saw Ginny post this the other day. She made her own hand sanitizer from aloe and 99% isopropyl
Okay.
alcohol. You can do that. You can actually do that. Find it, and
That's
there's
genius.
a lot of
I like
aloe vera grows here like crazy. So there's lots of people that have it in their yards. So that's pretty cool.
Yeah. I mean,
But
Hey.
thieves oil not going to work.
one of the other things they talk about, they were talking about Lyme disease, but 'cause they try to do all sorts of, and I know Travis Moorhead has had to deal with a lot of this stuff, and none of
Right,
it really
right.
has worked that well, except just eating super clean ended up doing the most benefit. I think. Probably ask him to be more specific about it, but I seem
Right.
to remember that was what it was. But he was saying that they finally took like this main cocktail that cost a lot of money that they were giving people and gave people a placebo, and the placebo did exactly as well.
Right.
This is the
This
thing,
was
like
his bee sting therapy for Lyme disease. I remember
yeah,
when
for a
Travis-
while there's a bunch of weird shit.
Yeah.
That's the thing. Most of it is just false, right? Like that there's a reason why science is winning, and it's not because crystals work.
Right. Okay. What is Corey pouring over there? It's probably not elderberry syrup. That's gonna be my guess.
Sweet elderberry syrup. That's just it's just coffee. Sylvester,
It is
sorry man, I
delicious.
know you.
Let's
I
not,
know.
as
I just
Sherry
wanna-
Bernie points out.
Yeah, I wanted to apologize to Sylvester. I know that's not what you said. There's just
Yeah, so I put a
lot
little,
of
I threw a little quick recipe up in the comments section for a cleanse water. If anybody just wants, it's really good for your body. It makes you feel good, and it helps kind of keep things balanced.
Yeah.
Add some lemon, some ginger, some apple, and some cayenne pepper. Put it in a tub or a thing, and put it in your fridge, and drink that throughout the day. Stuff like that's actually worth it. Ginger tea, turmeric, all of those things are actually really amazing for your body. And help digestion and assist with immune system boosting and so forth. So if you need some simple ideas, there's certainly plenty on Pinterest, but you're welcome to throw yours
Yeah,
in or
this
ask
whole
me or whatever.
yeah. A couple of people have pointed out in the comments, Jen and Sherry Bernie. Yeah, I've been social distancing myself since I lost the mayoral election, so I'm like really ready for this moment. Like,
Got it
nobody
down,
comes
you're
to
an
our
expert
house.
now.
Like a couple of people come visit us. I spend one day a week out of the house. Otherwise, I'm here in my Hobbit warren.
That's
And
exactly.
I just the reason I giggled a
And
minute
they're
ago
taking
is
the
'cause-
ring to Mordor for you, huh?
That's it. Yeah, because Corey, I got the replay delay feed of Corey doing his his my precious with his coffee, which is kind of adorable. So okay, so
and
let's
that's like the things that are supposed to increase your immune system. I'm always like just immediately skeptical of all of that. But who cares what I think, right? Because if you think that it is, and there's even a 1% chance that it is, the placebo effect. I know it sounds like it sounds terrible when you say it. It should just be like the human being's auto capacity to affect their own thing. And if you believe it, right, like that's a real thing. If you believe that
but Corey, food is
what you're
medicine,
ingesting is
right. Like
no, I get it. If
food
you're
medicine,
no,
you know
like
what I
to
mean?
what you were saying, if you're eating clean, like I think that's the thing that helped Moorhead the most, right? Like doing all these crazy microgreens and like just stuff that is like hyper dense in nutrients, right? Like if you're eating that way versus eating with Cheetos, well, the people eating Cheetos are probably not going to weather this quite as well. So that's like a
I am
legit
so
thing.
fucked.
It's true.
I am so
Take out,
completely
dude.
fucked.
You're in deep shit for sure.
And I don't even like Cheetos.
Right. And again, like and everyone should know I'm in no way, shape, or form an expert on things that will, increase your immune system, other than that basic, like, it's probably worse than microgreens as an example.
Yeah.
So don't take my
But you're
fucking-
right. I think eating clean is a worthy conversation just in general, because I think that, we don't do enough of that. We've become a country
Yeah.
of like factory food, and unfortunately that's killing us. And so I value eating clean. Whether you eat meat, whether you don't eat meat, it doesn't really matter to me. I just think that in general we just have to be conscious. When you cook something, maybe cook it a little bit longer this time. I don't know, whatever. But the idea of just eating clean, because food is medicine, nutrition is medicine. When you do that, when you pay attention to what you're putting in your body, you're going to weather way more things.
Doreen just said, "Now my kid wants Cheetos." Sorry, buddy.
Yeah, we're causing all sorts of problems for people whose kids are watching.
Eat your broccoli for your mom there, Butto. Butto?
Yeah.
What does that even say? Anyway,
What?
the idea.
Buddo.
Butto is a word I say now.
Okay, yeah.
Tie together on the potato
Jen
chip
wants to
diet.
know if Ash can be her life coach.
Yeah. I don't know if I'm an expert on life or anything, but I'm glad I can inspire.
Yeah, Silvestri has a good point. What aisles are empty in the stores? The chip aisle.
Yeah. Ginny actually put her recipe for hand sanitizer right in the thread for us, because that's the kind of awesome person she is. Rubbing alcohol, distilled water, aloe vera gel, hydrogen peroxide, vegetable glycerin optional, essential oil optional. That would be for some sort of scent component to that. So
I
that's
think there's
cool.
also recipes for like vinegar. You guys will have to look it up, but I think there's recipes where you put like vinegar and lemon and aloe vera and stuff together as well that can also be used as sort of disinfectant.
Right.
Still
not as good as actually,
worth checking that kind of stuff
medical
out.
alcohol would probably be the best possible solution for that. So
I think. Okay, so Dave Myers wants to get a slingshot and some frozen elderberries, because this is how we stop the coronavirus.
that's it.
Also a good T-shirt.
We just
Anyway,
shoot them at the
Dave,
heads
you
of
could be
children
making
who
money
are
on these
coughing and
t-shirts
not
you're coming
covering
up
their
with.
mouths.
I guess, hey.
Yeah.
Well, yeah, I think I honestly I think that I wish Dave Myers was like stone cold millionaire from the fucking T-shirts and designs he's come up with, because he deserves it.
So let's talk about some good news. How's the stock market doing today, Corey?
Tell us about the money, Corey.
Oh my god.
Frick.
Yeah, watching it this morning.
Even rich
So-
people are sad today.
Yeah. Yeah. The markets were not impressed by anything that
right.
was said last night.
I think this is important to say, that there was an absolute causation between President Trump's
Oh, yeah.
speech last night and the market, because right after the speech, the Dow futures dropped 600 points. Like, no one in the world of finance was reassured by what the president said last night.
It's because it was all nonsense.
Ultimately, that's what we count on the president to do, is to reassure people in markets everywhere. And he is like the anti-reassurance. He absolutely tanked the market overnight. So good job. Good job.
Yeah, so it's now sitting right. I was showing Greg this on a chart before. There's a level that I've been telling everybody about at around 22,000, which is where it bottomed out in 2018, 2019. And so basically, if it were to hold that, and something in the fundamentals were to change, like the ports were suddenly like, if we were hitting this level at the end of all of this, not at the very beginning, that would be a lot more interesting. But what the scary thing is if it drops below this, if it closes below this, then in all likelihood, at a bare minimum, we're going to 16,000, which is like a 50% drop on the Dow from the top, which is pretty nuts. And people that are much smarter than me are calling for 7,000. And honestly, because like events are canceling, cruise ships are all shuttering, like all the knock-on effects of all this stuff. The biggest thing for me is like the ports are all empty. If you're into manufacturing anything, you don't have parts, so that's only going to get harder and harder and harder. So for the next few months, things are going to get a little weird, right? Like it's not survivable. It is. There is a lot of intellectual and human genius momentum behind all of this, even when it is broken. But for the next little bit, it's gonna be strained.
Right.
Well, the system, I mean, in general, the system is broken. I'm curious only
Yeah, it's
because I
true.
don't necessarily always follow up, but has Yang said anything about all of this
Yeah, he
from
said
a market
apparently he should
perspective?
have been talking about pandemics the whole time because even AOC is talking about UBI now. Like a
Yeah, I did
lot of
see that. I noticed that
yeah,
on her Twitter.
a
Yeah.
lot of people are talking about straight emergency UBI stimulus. And but this is the thing though, right? Like to put this in context, this is a very scary thing. And we should be intelligently concerned, not panicked, right? And we should do, whatever smart things we can do about it or whatever. And it has the capacity to cause a whole lot of damage. But this is the kind of damage that people that are at the bottom of our economic strata live with every fucking day. Like being on the bubble, being scared, not being able to afford healthcare, not knowing where your next meal is going to come from, not know who's going to help, being socially ostracized, not just distanced, right? This is all things that are happening right now. And that's why like it's like my best hope for all of this, silver lining wise, right? Say they do a UBI stimulus, realize that with a VAT they could pay for it, and just understand that it'll allow us to weather things like this, because this is the quite frankly, with the kind of other exponential curves that we're facing, this kind of thing is not going to be the exception. It's going to become the rule, right? With a connected society, this is how this works. The automation curve on people losing jobs is going slower than this, but it's still an exponential curve, right? Doubles aren't happening in 4 days like they're happening now with this virus. They're happening every 3 months, every 6 months. So it's tougher to see that we are in fact in the knee of the curve right now. But pretty soon, like it's 10 truck drivers are losing their jobs, then 20, then 40, then 80, then 160, then 10,000, right?
Right.
So it's going to be.
I mean, you say truck drivers, and that just breaks my heart because I mean, I come from families of like truck drivers and working class people.
Yep.
And and that
and that's
kind of
just
stuff. And so, but
it's
that
just an
means
example.
our system is broken. I mean, I went on my little rant yesterday, but like our system is fucking broken.
Yeah.
And I just to me, I've got contentions with both Bernie and Joe, but it doesn't even matter to me who is on the ticket in November, because they're the outcry to change the system. We can have unity and want to defeat 45 all we want to. All of that stuff is all well and good, but there still needs to be radical shift in our system. Everything from healthcare, which is number one at this point, to the market, to how we handle bigger businesses, to how we handle jobs. I mean, the fact that people they can't take sick leave. They can't take sick leave. They get 2 weeks of paid vacation and maybe a couple of sick days. First of all, why are we a country that only lets people off for 14 days a year? Really?
Right.
The system is broken so deeply, so badly, and of course, marginalized communities, of course, are going to suffer the most. Veterans, POC, and other working class folks are going to genuinely suffer from these things. And if this is not rock bottom, then what is? And so, this is what needs to be a wake-up call to our system change, right? Regardless of who's on that ticket in November.
We talked for 18 minutes this morning before the show about all the bad stuff, and then we kind of rallied like we do about, okay, so what's the good news? If there's ever been an eye-opening lesson about why Medicare for All and UBI are critical, why deep systemic change on environmental policy and regulatory policy is critical, why rescuing ourselves from what Trump has damaged at the FDA, at the CDC, at the, in all these agencies, this is the vital lesson that we needed to learn. And it's sad to me that we had to have a disaster to learn it. But the truth is, people don't change unless there's pain. Generally speaking, unless there's a deep catastrophic problem, we don't systemically change things.
Well, I talked to the NASA, so I did actually really want to share this with you guys because this is one of the more exciting stories that I've gotten to do lately, and that is I had a chance to talk to the NASA guy from the research team that put out the pictures over China, and he was such a lovely human being to talk to. I first just want to just sort of credit him with that because he was such a good person, Dr. Duncan, and he said, look, he said, it is a very serious issue. We can see it on the map. We can see it from space. We're taking pictures of it. But ultimately, he wants to feel like there's hope. He said, look, never before in the history of our existence have we had technology like this where we can actually see it. where we
Yep.
can actually go in as close as he said we can actually zoom in as close as some of the major factories that are out there. It's amazing. And so when they produce those, or when they release those pictures over Wuhan, China, and by the way, the head of the research team is a Chinese American woman. And she had already been kind of keeping an eye on it because she has family in China. And then the team, there's about 4 or 5 of them on the team who happened to notice these pictures were taken. He said it's actually really beautiful in a way to see the change that was made over Wuhan, China. The sky was blue. It no longer had these dark gold spots everywhere, which is their signs of pollution.
Right.
And so he said, we have the data, we have the ability, and we have the technology. He said, I want to preach a little bit of hope because in his mind, it's about being able to say, look, we have the resources, let's utilize them.
Yep.
And I
That's
agree
smart.
with that. And I'll put the link in here, you guys, so you guys can take a look at this piece. I'm just going to hit enter there right now. I don't know if that actually pops up, but I think it's really important to recognize that if this is our wake-up call, let's also recognize that in the 21st century, we have the resources to actually start looking at things for our environmental policy, for our food policy, for our healthcare policy, for our jobs and market policies. And I think a lot of people end up leaning toward Joe. I sometimes think that the DNC wants to give it to him just because what was it the comedian said the other night? He's been running for president since 1980s. Like he's run for president like 3 or 4 times.
Here, can I push back on that real quick?
Yeah,
Like,
push back. I'm not saying I agree. I'm just saying
but like
the truth.
Anytime somebody says the DNC wants X, they're usually very, very wrong, right? The DNC was absolutely willing to throw Biden under the bus unless he won South Carolina, right? The DNC, the DNC actually hasn't been putting their finger on the scale this time, really at all. Period. Right.
The DNC changed their rules in this cycle to make sure that Bernie got a fair shot.
Right. Like that. So, like it's this common theme that, oh my God, like and again, like there was weird shit that happened in 2015, 2016. I was there. I get it. Right. And and obviously it looks to people that are outside the system like the entire establishment got their marching orders. No, Biden called Beto and had a conversation with him. Biden and the team, right, called Amy Klobuchar and had a conversation with them, and they said, hey, do we all want to coalesce around one candidate, and I'm the only viable one left, and do you want to spot in the administration with some clout? They said yes. That's called democracy, right? That has nothing to do with the DNC at all. Like the DNC literally would have thrown Biden under the bus, right? Anyway, sorry.
I'll accept that. No,
that's not so much coming from you. I'm seeing that from everybody, and it's driving me insane.
Look, I've seen both sides of this argument, to be honest with you, and I'm not necessarily leaning toward one or the other. Right. I actually do believe in a lot of the radical changes that Bernie wants to make. On the other hand, I also understand some of Biden's sort of unity stuff that I think that he's probably better at from like a softer perspective. But I also have contentions with both of them. So my first choices were women. So at the end of the day, I've to me, it's just about whichever candidate gets it, whether it's Joe or whether it's Bernie. Both of them are going to have to significantly recognize that there's compromises that have to be made and radical changes that have to be made in order for not only the win over 45, but in order to bring our country back into, this isn't just, let's just get back to sanity. Fuck sanity. It's gone. We now need to actually begin to shift so that we can heal, so that we can become united again, so that people can be supplied for, so that people can have equal rights. So, and that includes in our healthcare system, so people can go to the hospital and be able to not fear that they're gonna have to pay $3,000 to get tested or not get tested at all, or whatever it's gonna be.
Yep.
So, my take on this is that regardless of who's the candidate, let's now look at this and say, now we need to go down to the local levels, the state levels, the county levels, and start convincing our. I read today that there was a Republican in Tennessee who blocked a motion to force insurance companies to basically cover coronavirus testing.
Yep.
Mm-hmm.
I forget his name. I think it was on Donna's page because I wrote vote him out or something like that. And
sorry guys, there's Pelosi Pelosi might be speaking here in a second.
Yeah, put her up if she's gonna. She'll be more sane than.
Yeah, this just started. Hold on.
Yep.
As soon as we finish the appropriations bill, listening to our constituents, listening to healthcare professionals, listening to governors, mayors, etc., put the Families First legislation together. It has free coronavirus testing, by and large, for almost everyone in the country. We're
Sorry.
having some discussion
I have
about that
no
with the
idea.
administration.
What just happened? My screen just went crazy. So, there we go. That's gonna work.
Of maybe some people they want to pay, but by and large, free corona testing so that everyone, public health challenge that we have, enhanced unemployment insurance, the first step that will extend protections to furloughed workers, strengthen food security initiatives, very important. Many kids just get their food security from being in school. If schools are closed, we have to make sure that the food gets to the children. This food is already paid for and appropriated for. It's just a question of getting the food to the children, and that has some cost to it. We also have to get, that's a school lunch program, et cetera. But in terms of SNAP and food assistance for seniors, people with disabilities, helping the nonprofits who are on the forefront of helping people have access to food at this difficult time. And then clear protections for our frontline workers who are working in infectious environments or possible infectious environments, so that the OSHA regulations are a protection for them, and then increased funding for Medicaid, the FMAP. That's the program, the initiative that gives money to the states for Medicaid, that is used hopefully through the counties and the rest, which deal with many of these health issues, to as we go forward. So it's about putting families first. We did the major investment last week. We were very proud of that. Strongly bipartisan, already signed into law, Families First. And there will be other initiatives that we want to work with the administration on that may be necessary as we go forward. Some that need more discussion, more impact in terms of what is the collateral benefit or collateral damage to stopping the spread of the coronavirus. Now, let me just get back to testing. So very important to take inventory, to understand the epidemiological spread of the virus.
Thanks, Greg.
And also to meet the needs of the people affected. I'm very pleased also this week that we were able to pass a bipartisan FISA bill in the House. That's a hard thing to do. I know that from my intelligence experience. And that we were able to pass Representative Slotkin's War Power Resolution, Rep. Lee's legislation to repeal the AUMI is the predicate for how we go forward, and Rep. Khanna's legislation to prohibit funding for military action. So as we go forward, I want to thank the members for the bipartisan legislation that was successful this week on the floor. In case you were going to ask, no, I don't think Bernie Sanders should get out of the race. I think I'm a grassroots person, a party, grassroots, chair of the California Democratic Party. I know the enthusiasm of supporters for candidates, and they want to see it play out, for the ideas, the causes that the candidate advances, for the opportunity for people to show their support. I congratulate both of the candidates as they go into the debate on Sunday. Wish them both well, and I'm very pleased that we're getting a chance now in a narrower field to be able to come close to having a standard bearer for the party. But either one of them, whoever is the one who emerges, the other one is a standard party bearer for a point of view in our party that is very important. With that, pleased to take any questions. Let me see, who? Okay, you.
In your opening statement, it sounded like you're open still to changing this bill, or at least tweaking it for some of the Republican and White House concerns. When you guys vote this afternoon, are you planning to release your members to go home, or will you keep Congress in session until there's a bill on the president's desk?
Well, we have, whether we go home or not is more related to the what the House physician, the Capitol physician says, and what the sergeant at arms and the police chief and the rest say about what could come next that we have to deal with, because they make statements every day based on the current state of affairs in the community in which we exist here in Washington, D.C. So I do think that some of the suggestions, what happened, we moved quickly because who knew, right, that we would be in this situation. We passed the bill last week. Immediately we knew we had to do more. We had to get it onto paper, and when we had it, then we shared it with the Republicans. They made some changes to it. We're negotiating with Secretary Mnuchin. He had some suggestions, all very reasonable. I think that none of them would prevent us from moving forward with the bill. We just have to, though, in the world that we live in, have language so that we can go to rules, so that we can go to the floor. I don't think we would wait until there's a signed bill. We will do our work, as I said, sensitive to changes that have been suggested. I don't think they're unreasonable. They're options that we considered in our own caucus, some of them, and we went one route, they want to go the other route. That's fine. But we will have done our work, and we would hope that that would be an incentive for the Senate to move quickly, because Leader McConnell asked me to work with Secretary Mnuchin. We are. He had his concerns. We're addressing them. I hope they don't move the goalpost. Yes, sir.
Yes, good morning. So to be clear, so you think you can look this bill out today and pass that with potential changes? Mm-hmm. And then the idea is that the House might go away. Well,
we take one step at a time. I'm not saying anything. We are here to pass a bill. When we pass a bill, we'll make a judgment about what comes next, and we'll see the manner in which the bill is passed. So I'm not giving any travel arrangements. I know you were busy about your weekend and that, but that's not what we're about.
What are those other things that you see? Obviously, these are things that you can do immediately, but what are the broader things that you might see doing in a couple of weeks?
Let us get this bill passed first, and then we'll see where we go from there. Because the fact is, it's like the house is on fire. People are concerned about their health and the health of their children. If they are losing their jobs because nobody's coming to the restaurant or whatever it is, then we have to be there with some help for them. And if their children can't go to school because the school closed, how do they afford childcare? Well, this legislation affords them the opportunity to stay home on
to your point, Ash, this should all be stuff that's already in place.
Leave for a while. So again, we're addressing the realities of life, of family life in America, putting families first. We're not planning a schedule or anything else until we get that done. And again, we had in our bill last week the provisions for the Small Business Administration to provide loans to businesses that were under duress, whether they lost their market overseas or their supply chain overseas, whatever it happened to be. And so that we thought was an important initiative to have in the bill. They may want to do more. That's something we can talk about. But even if you have your small business loan so that you can pay the rent on your store or your restaurant or your facility, if you don't have customers, you still have a problem. That's why when we do the TANF, the SNAP, the food stamps, when we do the unemployment insurance, when we do paid sick days, when we have paid family leave, parental leave, family leave, that money will be spent immediately, injects demand into the economy, creates jobs, is a stimulus. So this is not without its opportunity to stimulate the economy. In fact, when we did the American Reinvestment and Recovery Act, we asked Rosa DeLauro in particular, asked the economist, name some of the things that we could do immediately that would be stimulus to the economy. Raise the minimum wage, we're not doing that here, but unemployment insurance, paid leave, food stamps, et cetera, because, again, they go to people who have the need. They also have earned income tax credit, refundable and that, and there may be some things that we'll talk about in the future. Yes, sir.
One of the issues that the minority leader is talking about has to do with
The Dow has popped up 50
you
points
believe
since she
that
started speaking. Just saying.
hours, but if the Republicans are willing to stay and work.
Pelosi's working it.
What is the question? I've checked it out. The families have needs that I just described. We've made the proposal, which we started on Sunday and put out there. We're listening to governors, mayors, nonprofit organizations, educators, and the rest. This is what families need.
The Dow isn't reacting to this.
They
Greg.
made suggestions to
No?
the
Okay.
language.
No.
We're making, agreeing to most of it because they're not that different. So we don't need 48 hours. We need to just make a decision to help families right now because we have to operate not as business as usual, but in an emergency status where we have to get the job done.
But if the decision isn't made,
Yes,
will you stick
Nancy.
around?
I'm not sticking around because they don't want to agree to language. We're agreeing to much of what they have to look. First of all, Mitch McConnell called me and said, "You work with the secretary. That's it." Now the House Republicans are saying they're not in the loop. No, we sent them the language. It's not about that, and it's about putting people and families first. So I mean, everybody could have a complaint about this or that. I said, save it for another day. We can have an after-action review about how we got into this situation. Save it for another day. Right now, we have to find our common ground, work together to get this done as soon as possible because we have other needs. We will have to address this issue further. And it's some things that they might want in this bill that aren't there. There could be another bill shortly down the road. We didn't do everything last week with $8.3 billion, but we did a great deal, and now we're doing more, and then we're fully prepared to do more. So we're responding to their concerns. We don't want them moving the goalpost, and that's it. Yes, Nancy.
Perfectly stated.
Was it a wise move to block most travelers in Europe from coming to the U.S. for the next month? And if so, was it wise to leave the U.K. off of that list?
I had a conversation with the Vice President and Dr. Fauci last night when they called to inform me of this. Dr. Fauci said it was a scientific medical decision. I have a great confidence in Dr. Fauci. It's just strange because they're saying it's because it's easy to travel among these countries, but they're separate from the UK. Well, you can just get in the channel and you'll be in the UK. So again, it's a decision they made. It has its ramifications. We'll see whether it's worth the trouble. But again, I'm here about what we can do to go forward for America's working family, for putting families first without having a criticism of one of the other things that the president is doing. I do think, as Chuck and I, Leader Schumer and I said in our comments last night, testing. That's the only way you're going to learn about the epidemiology, how this is spread. I don't want to use that word because not everybody knows what it means. Yes, sir.
Last question.
Yeah, we have the Taoiseach coming, so I have to get going.
You said earlier this week that Congress is the last line of defense. Beyond the recess, wondering if it came to it, how prepared...
I said it was the last line of defense.
I heard you say that at some point. I'm wondering if...
A line of defense. I don't know if it's the last. Anyway. Go ahead.
How prepared Congress is to work from home, potentially, if it were to come to that.
We have been briefed by the Chief Administrative Officer, by the Chief of Police, by the Sergeant at Arms, by the Capitol attending physician, by our leader on the House Administration Committee, Zoe Lofgren, about what preparations have been made for remote work. And that is something that we're actually encouraging people to be prepared for. You know, they may choose to be coming in, but be prepared to do that. It isn't a requirement yet, but it is that we want people to be prepared. So we're providing the technology, the training, and all the rest to make sure that everybody is up to par on that. So our writing of legislation, our exchange of ideas and all, that won't stop the work of Congress, because by the time we come to the floor, it's the tip of the iceberg. There's so much else work that is going on. And that with all the respect in the world for our staff who do much of that and our members who participate in that, everybody is not universally at the same excellent at the same place in terms of technology. Want to make sure they're all at their personal best when that sets in. So it's about. I hope that much of what we're doing is redundant and that we don't have to engage in some of this. But if we do, we want to be prepared. We want to prevent the spread. So if people have to stay home, they have to stay home. But we also don't want people to panic. So that's why we've based any decisions about the Capitol, this or that, on what is recommended by the Capitol physician and the sergeant at arms and the chief of police. But it is, I think we have to be very prayerful about this. People are sick and some people are dying in our country and globally. And it is kind of shocking to see the challenges that we have and the decisions that have to be made about people coming together, whether it's sports or the arts or just political gatherings or whatever it is. We have to think in a different way about that, whether it's about personal hygiene or personal contact with other people. We have to be smart about how we do that, washing our hands for 20 seconds with soap and water. I say that all the time anyway as a mom, but so and now it's an imperative, but it's always been important. So again, as I say, what we think about one policy or another, as Nancy asked, what we really have to do is come together and get the job done. Now we were very clear in our communications about what we heard. And when members go home, they will hear more from their constituents, from their nonprofits, from their local government, from their healthcare providers and the rest about what other ideas have emerged as important in all of this. And that will be a source of knowledge for when we come back, and we could come back anytime. Everybody has to stand ready to be here at all times if we have a legislative solution to put forth. But again, it can't just spring from what we did before, anything like that. It's about what's current and the challenge that we face with this coronavirus. And it's not about spending a lot of time saying how we got here. We have to talk about where we go from here. And then we can make changes for the future and how we could prevent or withstand whatever might be happening in other countries that might spread to our own. But I do want to salute our healthcare providers, our first responders, all of the nonprofits that are working to inform people about how they should be tested. We are in our legislation, we enable millions of masks to go out. That was something very important to the administration. That we would suspend immunity for liability was a very big deal, a big concession to the administration on that, because weighing the equities, it would be important to get those masks out, even though it provided that immunity. So we have tried to say, okay, we have our, and it's just specifically for the coronavirus crisis. So anyway, I thank you for your interest in all of this. I want you to wash your hands for 20 seconds, not just all the time, just for no reason at all, for no reason at all. And one bit of advice they told me, I was talking to somebody from California, and I said my usual thing, that a month ago I might have said, whoever the nominee is of the party, we will enthusiastically embrace. And then I changed it to, whoever the nominee is of the party, we will enthusiastically elbow bump. But somebody said to me, no, when you elbow bump, you get close to the person. So forget any physical contact. Greetings. Now in Eastern
I'm good with
Thank
that.
you all very much. And again, we're very excited that the
All right. So there's all that. Yeah. Seriously, live long and
Live long
prosper.
and prosper is a pretty
The
good.
fucking Vulcans knew what was up, man. I'm telling
Yeah.
you.
Yeah.
Yeah. Well, I mean, look, she's right. I mean, she's, I'm glad that she came on to speak. I think that she does bring some calm to the situation. She obviously sounds a whole lot better than the president, and she's much more calm and collected about what needs to be done. And of course, she made the point there at the end that we need to start having conversations about how to go forward and the changes we need to make, because we can't keep wallowing in, oh God, how did we get here? The doom and gloom of it all. Well, we're here, so let's take one step forward and try and solve the problem rather than whine about it. And so I appreciate Pelosi standing up and getting up there and doing something about that.
It is striking to me that I can't remember in my living memory a time when the Speaker of the House was more informed and a better vector for good information than the presidency. The presidency is always where we've looked in a moment like this for messaging that is reassuring and helpful and direct. And the idea that there's a vacuum in that regard bugs the shit out of me, and will until November 3rd of 2020. I want to go back to something that Donna Arbogast asked up thread. Do you see job freezes coming, hiring freezes coming? Boeing did so yesterday. Boeing instituted a hiring freeze yesterday. So on day one of this apparent tumble, big companies are already recognizing. Carnival Cruise Line suspended global operations. I would expect they won't be doing any hiring anytime soon.
Yeah, for 60 days at minimum. That's
the other thing
like,
is that
things are going to grind to a halt.
This is much worse than just hiring freezes, because somebody in the comments posted, I'm looking at the things that are being canceled. The Boston St. Patrick's Day Parade. Think about the impact on the local economy of that event. The St. Pete Grand Prix, no more general admission tickets. That's every business in downtown St. Pete that counts on all those folks coming to their restaurant, their store, their gas station, the people that vend along the route of the Grand Prix, all the people that sell hot dogs and sodas and pennants and programs. None of those people are going to have those gigs now. And if you're working gig to gig, like most festival vendors do, as these festivals and concerts dry up, that's minor things. Now I'm sure we already know that big business conventions are being canceled, that a lot of Comic Cons are being canceled. The Minecraft annual conference has been canceled in Orlando. I'm heartbroken because I really wanted to go. That's a whole lot of working folks that are going to be suffering deeply here. And then those people are not going to have money to go out and contribute to the economy in other ways. So I actually think it's much worse than hiring freezes economically. And I think that's, as Corey has explained to me, that's why we keep falling through supports here, because if there was some daylight, if there was some indicator that, well, this will turn around in 30 days, this would not be happening in the market. But like you said, it's not like suddenly a whole giant, 20 giant shiploads of parts for things are going to arrive in the harbor in Los Angeles.
And even if they did,
right,
it's gonna time when they show up at the factory. That's when they're going to be shutting the factories down because people are getting sick at work.
Right. And the other, the other thing I learned about that, living on an industrial coast where there was a huge paper mill, is it took them 5 days to turn that paper mill on. Anytime they shut it down, there's a period, it's not like you flip a switch and the whole thing comes to life. Massive industrial output factories require days or weeks to spool up or spool down. So, there's no short-term good news here economically. And I honestly, I don't think that whatever stimulus, whatever package the House puts together, if the Senate even entertains it, we've already been so stressed. The idea that we have kids that are getting their only daily meal at school.
Yeah.
The idea that half of my county is below the Alice line, asset limited, income constrained, employed, those are factors that were already desperately bad. And this is not this is just an example of what happens when you automate all the jobs away. Right.
Like the markets don't even matter right now. What matters is those kids are going to need food. The parents are going to need financial support to stay home, just to do everything that they need to do to be, as smart about this as they, need to be. And even the number of nurses that have kids in school, like all of this stuff just needs to get fucking dealt with. right? And all of the industry is going to do what industry is going to do, and we have to deal with the ramifications of that as well. And again, like 90 days from now, we could start putting it back together and building it back up. But this just the support needs to just show up. And frankly, it really is like it's all the things that Democrats have been talking about for the whole time, right? Whether it's federally mandated childcare or fucking universal healthcare, like that. You'll be able to do a study a year from now. The industrialized nations that have universal healthcare will have like 30% less dead people, 50% less dead people. It will be a large number. And it's stuff that we could have just done if we were smart enough to do it. And there's, like a dozen of those things. And UBI is obviously getting floated in for really, really good reason. So, I hope they pull their collective heads out of their asses. And by that, I mean the Republicans. Like the Democrats seem like they're at least trying to get on this as much as possible. And I really loved what she said too. Like this, we're just going to get this done now. Like we're not, don't be silly about it, because we can always do another one tomorrow, and we're going to have to.
Right.
This is just getting warmed up.
Well, I saw, and then this is where communities need to come together, and this is where good bosses also need to sort of step in and try and help their employees with these kinds of things. I actually saw today, who's the guy from Shark Tank, the basketball owner, Mark Cuban.
Yep.
I saw a statement where he gave today where he talked about, because, they're going to kind of have to shut things down. The NBA's shut down. He said that includes a lot of the employees who were there, who are hourly workers at my stadiums or at my stadium. So he's now trying to come up with a plan. He didn't have all the details at the time of the statement, but he's trying to come up with a plan to make sure that those families will be supported during this time if they have to stay home. And, he said, maybe we all try and do some volunteer work or something later or whatever. He's like, but what I can do now is I want to make sure that these families are supported, because a lot of these people are hourly workers that might not even have the resources to be able to do this. But at the same time, we can't play games at this point. This is what the NBA is doing. So, he's somebody who's like, okay, I'm going to try and come up with a solution here. And that's what we need. We need people like that to kind of step up and say, Michael Bloomberg has a shit ton of money, and he wasted $500 million or whatever the heck it was on stupid campaign ads. This is a guy who could go back into New York or whatever and could invest amazing amounts of money into the healthcare system for New York to make sure that Cuomo is applied for. You know what I'm saying? So this is where, especially the Democratic wealthiest, maybe need to start stepping up as well and start helping and putting money back into their communities, because they can't afford it. The least of these can't.
Right.
But the rich
I'm
ones
actually
can.
confident that Michael Bloomberg is going to do exactly that. He has been instrumental in the reason New York City has universal child health care is because Michael Bloomberg, insisted on it, made it happen. And he did that with some of his own money. I also I'm he was my fifth favorite candidate in the race, but of the 500 million that he spent, 350 million of it was on anti-Trump ads, and those are working. So I don't think that's wasted money. It goes in support of the eventual nominee. However, I did see yesterday that the thing that I was told, because I was like one step from being onboarded by the Bloomberg campaign here in Florida as an organizer, is that the promise that people were going to be rolled over into other campaigns and for the Democratic Party of Florida is not coming true. A whole bunch of staffers have had no word about whether they are going to continue to get paid or not. So that's the downside of the Mike Bloomberg promise. One of the reasons I was ready to say yes to that job was because they told me, if he's not the nominee, then you'll be working for whoever the nominee is. And it turns out, according to state staffers, that's not what's happening.
Yeah, that's pretty cheeseball. I'm not gonna lie.
Pretty awful.
So yeah, Greg, this is what I was talking about. The speech started right here.
Right.
And yeah, like it looked like it was coming up, but it just hit this. It hit this. This is a.
So it's unrelated,
resistance.
just unrelated to the speech.
Yeah, it's unrelated.
Okay.
All
right.
So,
Hey,
yeah.
It's 11:15. Why don't we get the hell out of here?
It is. I just want to let everybody know, these kinds of conversations that we're having today, these are kinds of conversations that I'm going to start ripping apart through the podcast. And I know that everyone's crunching numbers right now. We're all a little bit low, but one of the things I'm doing with Birth is that two things, actually. All of the money that goes toward this sort of podcast essay portal is going to go back into me finishing the book. And two, I've decided that since it's only $5 or $5.50, $1 of it Once we reach about 150 people or 150 subscribers, I'm going to take a dollar of it, so that chunk of it. So, for your 550, a dollar of it, it's going to go toward charity.
Nice.
I've got a couple of ideas as far as charities, because I want to focus on sustainable living and kind of those kinds of themes, because it is about body and earth, which is sort of my connection point at this point. So just so you guys know, if you are able to do that, or even if you're only able to subscribe for 1 or 2 months, that's fine. Tell your friends and share it. And the link is at ashgallagher.com, and you'll see a link there for Birth, or ashgallagher.com/birth. And you'll get all the information about it and the podcast. The first series, each month I'm going to do a week-long series where I'll have some essays as well as at least 2 podcasts. And in the between those, I'm going to do one-off podcast and audio cast, as well as this week I'm doing International Women's Week with some poetry. But on the 21st, the series on birth and trauma and healing is coming up. I've got series on addictions coming up next month, food, and some of the stuff we were actually talking about today is going to be part of that. And then last month, when I opened it up, I did on plant medicine, specifically ayahuasca, and I actually talked to one of the members of your community on one of the podcasts as well, and he shares some of his side and his thoughts of it, as well as my own experience. So we're just kind of putting that out there. Like I said, all the money that I raised through Birth, we're going to put a chunk of it toward charity once we reach 150 people, and the rest of it then goes toward me finishing the book. So if you guys are interested in checking out that and having these kinds of conversations continued, please join up, and I'd love to have you.
Beautiful. Thanks, Ash. Thanks for spending some time with us this evening. I know that sounds weird to us, but
thanks for reminding me. I kind of forgotten. I'm so sorry.
Yeah, no, we were sort of in the same boat, and that was the whole reason why we were getting together today. So I'm glad that you were available. Anyway, that worked out really good, because you're awesome.
All right. Yeah. The link to Ash's content is in the thread. That's the main page. Then there's you click the content or the projects label, and you'll see the podcast stuff and the book stuff. And she is in the process of finishing up and editing what we are sure is, we've seen some preview content. It's going to be an amazing book about her experiences as a war correspondent. And she's living an amazing life, and we're very proud whenever she deigns to come land on our little perch and share an hour with us. It's pretty special. So thank you, Ash. We appreciate you being here today.
Thanks, guys.
Yeah. We're back tomorrow. We can do tomorrow? Yes.
Yeah. We got Aaron from Three Right Turns coming on.
Oh, right. And then Sunday, of course, is the Church of Reason sermon that happens at 10 o'clock on Sunday mornings, live from our Minecraft server. If you have Minecraft Java Edition, you can join us in the game. If not, we'll live stream it here on YouTube, and you can see all the cool stuff that we're doing. I remade the Origin Cave last night, so I'm
probably gonna go in there and
I'm going to decorate it a little. Like I want to tweak it a little bit. I dug it out a little deeper, a little bigger. And so it's it's pretty cool.
Okay.
But that's what's happening with us here at Hashtag Coffee. Of course, we would love your support here. If you, are feeling double generous today, you contribute to Ash, and then you go to where, Corey, to contribute to what we do here? SoLocal.live/donate. We would love for that to happen. That allows us to keep into the wealthy style to which we've become accustomed.
Yeah, basically, like the Zoom is paid for. Which is
that's what's happening.
But that's honestly, like, that helps me out a lot. Like, because it without the donations we already have, I probably would have had to stop doing the show.
Right.
So it's been extremely helpful.
It's also, the other thing about that is, like we were just talking about, having social media non-distancing events. We can host more than 3 people on these Zoom chats, so we can actually do Zoom chats with whoever want to drop in once a week for a.
I've been thinking about that a lot, especially if for people that are subscribed and put in a couple bucks or $5 a month or something like that, have it so that they can be part of the thing here if they want to.
Yeah, I think it's what we should do.
I like it. Yeah, because that's the thing. Like, if we're all in our houses, so be it. Like, we hang out once every day. Right. And I definitely, especially not living with all you guys anymore, I notice. I bug Greg all the time.
We don't miss you at all.
You want to just, I know. You shouldn't. I'm an asshole.
I was hanging around with Dino the other night. He was, fuck that guy.
Yeah, no, I don't.
Miami. Who needs him around here?
I hate Dino. Dino's an asshole.
Not true.
By the way, we just crossed 2,000 points down, so that's fun.
Oh, yay. Okay. Yeah. We will love you long time if you will share our stream back to your social media platforms so other people can see it and join us. We're at 158 subscribers now, so we're slowly climbing towards 1,000, which is what we need to make this
not an exponential curve.
Yeah, not much
Yet.
of a curve at all.
Well, there's a bit of a curve.
Okay.
It's not a
initially pretty
downtrend.
good curve, right?
So that's
true.
that's a good
That's
thing.
true. We're trending up. All right, so that's going to do it for hashtag coffee today. Let me start that
And
again.
scene.
That's going to do it for hashtag coffee for today.
Sasquatch
I am
is
Greg. That's Corey. That's Ash.
real.
And we will see you tomorrow morning, 10 o'clock, same bat time, same bat channel. Sasquatch is real.